and then somebody else has been a large advocate of socialized medicine, and they've got a relative in Canada and just got cancer and had to come down to Los Angeles to get treatment because you just take a number and get in the back of the line. I think the cost of medical care is too high right now in this country, but I don't think socialized medicine is the answer, and that's what we try to do. You hear the SChip thing, that was a big thing in the news. I voted against the SChip because basically it was a deep step to socialized medicine. It would charge you taxes, and your taxes would go to pay somebody $100,000 a year, making $100,000 a year to get free medical care for the kids and themselves. I don't think you should be paying taxes for somebody that earns $100,000 a year to get free medical care. I'm sorry, you may disagree with me, and I apologize if you do. I just don't believe that's socialized medicine is not going to be good for New Mexico. It's going to take money from us and send it to the big cities.
Well, what about a family who has a sick kid and they have to go through all the red tape Medicare, and they can't treat the kid right away. So 3 or 4 years, a couple years down the line when they can actually see the kid, that ends up costing us more because now we got to treat the whole thing when we could have just prevented it. You know what I mean?
Yeah, those delays, it's a government agency, but frankly, a lot of those delays have been pulled out. You're just not seeing much kids needing help today that can't get it. If Medicaid is not able to do it, you have the indigent care program in the county. And indigent care is anybody who can't get treated. They simply go and they get treated at the county hospital, and the county picks up the tab. So there's some coverage there for anybody. The SChip program itself was designed for kids with low-income families, and the parents can't afford health insurance, and so that's what the program was designed for. What has evolved into a program where it is actually far more than that, and so that the adults are getting it, and it's up to 60 or 70,000 already, and we're going to put it up to 100. So those to me, I would rather find the solutions to where you can still deal with your doctor and figure out that solution to your medical problems rather than a government medical program.
What kind of medical plan do you guys offer for the general public? Because a lot of people make $20,000, $30,000, $40,000 a year and end up paying $500, $600 a month for medical care, which only covers 80%.
You're describing basically the medical plans that are available. The one thing that we did, I think, that would really affect the cost of medical care were the health savings accounts. And the health savings accounts are where you can put money at any age into your own account, and then you can use it for 4 elements of your medical care: to pay your premiums for your insurance, to pay your deductible, to pay medical care just out of your pocket, and there was one more, I forget what the fourth one was. So you get these 4 capabilities. Now it's a medical IRA, but in typical IRAs you can't spend it until you're 62. In this IRA you can spend it at any age, so you're putting money into your health savings account. Basically, one of the things that's really driving up the cost of medical care is people have the $20 copay, and for $20 they go to the hospital for anything, and so they're demanding more services. If you were choosing to spend your own money and to save that, then you would make the choice that, I've got a headache, I'm not going to go and spend my deductible going to the emergency room. So that would then say you would make a different decision. Incrementally across the nation, all 300 million of us making different decisions that would cause us to lower the requirements on the medical system, would begin to drive the cost that direction. So the health savings account was one of the big things that we did.
So you're advocating for 25-year-olds to have a savings account for
the health savings
a health savings account. So 25, 30-year-olds, 22-year-olds should put money away from their paycheck to cover.
The health savings account is actually an insurance.
I don't know very many 20-year-olds who like to save money.
It's just it's got to be a fact. To consolve your programs, the government cannot. The government is not the best way to solve your problems.
Well, it works for Medicare, though. I mean,
the government solving problems of people who are in their 70s, that's Medicare. That's a different deal. They have lived their life. They have made different choices. They're there. They can't go back and rethink it. At your age, you really do need to be thinking, because we can make all the promises in the world, but no matter who tells you that we can pay all your medical care all your Social Security, you never have to worry about anything. Those systems are way overspent, and they're going to simply be worse and worse the deeper we go.